Okay, thank you everybody for joining us. So today is November 18th, and today we have the South Texas Family Planning and Health Corporation. We have Fatima, who is going to talk about the organization and what they offer, eligibility for teens as well as parents. So if you are online right now in the Zoom, I already have you written down, and so I'm going to input your continuing education training for you. You don't have to do that. But if you are watching this video back, you can always leave a comment in the Facebook page. You can call me, you can text me, or you can email me and let me know that you did watch it, and I will still input it for you. You just have to let me know that you did watch it. So I'm going to go ahead and I'm going to let Fatima take over. If you have any questions, you can put them in the chat or you can come off mute and you can ask, but we will have a little bit at the end to ask any questions that you may have. So Fatima, if you want to go ahead and get started.
Perfect. Thank you so much. Well, hello, everybody. Welcome. My name is Fatima Henriquez. I'm with South Texas Family Planning and Health Corporation. We're a nonprofit clinic. Is it okay if I share the flyer? Okay, let's see. All right, let me know if you can see it. Okay, perfect. So I'm with South Texas Family Planning. We're a nonprofit organization. So we have 6 clinics in total. Our clinics are located in Beeville, Rockport, Kingsville, Sinton, Corpus Christi, and Robstown. We also have a mobile health unit, which is called the Medical Support Squad, that is going around different counties, not only in the cities that we're located with a clinic, but it can go all the way up to San Antonio and different areas as well. So the mobile health clinic has the same exact services as a normal clinic. It includes the 2 exam rooms. It includes a lab area. So anything that you can get at one of our clinics, you are able to get in the mobile health unit as well. So we are most proud of our breast and cervical cancer program. So our breast and cervical cancer program allows women to get their pap smears, their mammograms, and we also get their results back. So we analyze the results, and if we find something abnormal, the women are called back and we let them know, and they can get further testing and treatment done with us. They don't have to go to San Antonio or Houston. We can take care of their case and we can apply them for Medicaid and everything so they can their services and other screenings can be covered through us. Most of those are done here in the clinic in Corpus Christi, but we allow them, we help them with transportation if they're not from Corpus. We help them with transportation, gas cards, so they can get here and receive their services. Some of our other services are other health screenings, like all their labs. We do cholesterol, anemia, diabetes, their blood pressure, any STD testing if needed. Our longest results would be for the HIV. That takes 20 minutes. So all your results you will receive before you leave that same day. Some other things we offer are immunization for students or kids. We do start seeing kids at age 9 and up for their sport physicals and the immunizations as well. Mostly their school immunizations, like when the kids are in 12th grade, they're trying to go to college. In order for them to register for college, they will need their meningitis, and we provide it for them for free. Any urinary tract infections that they need testing or medication, we provide it as well. We do have a pharmacy in all of our clinics, including the mobile health unit. They all have pharmacies on hand. So if you need a medication and we have it in stock, we will give it to you before you leave your appointment that same day. We do also provide referrals to any other screenings you may need and that we don't do. We will refer you to somewhere we know that can take care of that as well. We do education, which is mostly the part that I do. So education, we go to schools, provide any type of education that they're looking for. They let us know what topics they want us to research, and then we go ahead and make a presentation and do it for the kids. We also do it for adults if like there's a community center or anything like that. We are if they invite us, we're more than welcome to go and give them a little education on anything they decide if they want to do it on clinical services or if they have a specific topic they want to discuss or bring more light to. Um, we're a nonprofit, so we go based on family size and annual income. So we do have programs, well, multiple different programs we apply you to. And if you're eligible, you don't have to pay anything. Sometimes if you're not eligible, we can work something out. We have payment programs. So whatever you can pay us, it's okay. We'll help you out and you won't be turned away. No matter what, you will receive all the services you need. So we do see men, women, and kids, kids starting at age 9 and up. We see our patients all the way to the age of 64. And we see uninsured and underinsured. Even if you have insurance and you want to use it through us, we can bill your insurance. Are there any questions?
I think I've seen the clinic maybe across from the stadium near the college. Is that
Yes.
your clinic in Kingsville?
Yes, ma'am.
Oh, okay. I didn't know if that was related in any way to Planned Parenthood or if it's a separate entity.
No, it's a totally separate entity.
Okay.
I think the only question that I have, I guess, is like, I guess, right? So most, right? So let's just say you said you see 9 and up all the way up until like age 64. Do you feel like, because sometimes some kids already have like a pediatrician, so they're able to kind of get some certain things that you have listed. They're able to go to them directly and already get that. But is there, I mean, how do you, I guess, like when people give you that pushback a little bit, only because I've been to y'all's clinic. I actually went to y'all's clinic at the beginning of football season because my son's pediatrician is actually in Corpus. So I was like, rather than drive all the way over there for a physical, I just went in with y'all and got the physical there. So is that something that you feel like it's also like a convenience if their
Yes.
doctor
And
is out of town to where they're just kind
yes.
of wanting to go?
That that is a convenience. Also, sometimes it's hard to get into their doctors, and we try to get them within 3 days. If you come in, you call us, you want your appointment, we'll try to get you within 3 days. And a lot of times you have to make the appointment way before, months before, because they're booked. So a lot of times we do provide all the sport physicals and immunizations they need because they can't get into their pediatrician. We also work with Kingsville, the district there in Kingsville, we provide the sport physicals at the high school as well during the summer. And if we're requested to go anywhere to provide services, like I said, the mobile health unit can go and do that. And even if you just want like sport physicals in a specific area in a different organization or a school, we can take our staff and go and do them there as well if they can't get to the clinic.
And then you said you also have a mobile clinic. What are the, I guess, the hours, or like, is there certain days that y'all are in like certain cities?
Yes, our mobile health unit is most of the time there it's requested. It's
Okay.
requested for different events. It's requested for different to go to different organizations. And that goes to Sarah Villarreal. She's the manager of the mobile health unit.
Okay.
And mostly you can request it online. So at www.stfphc.org. You go on our website, there's a tab that says mobile health unit. or mobile health clinic. In that time, you can request where you want the clinic to go, and you can see more information of where the clinic is at that in those specific dates.
Thank you.
Yes, ma'am.
And then as far as, I guess, what is the process as far as if, let's just say one of our parents, right, doesn't have and kind of needs a little bit more information, what is, I guess, is it just them filling out, like, how would they know, I guess, if they're eligible? Do you let them know right then and there?
No matter what, they'll get their services. We do the eligibility process there in the clinic. It's done right before they get their screenings. We have them fill out the paperwork, then they go on and get their screenings done. We're a nonprofit, so and we're a Title 10 affiliate. So no matter what, even if they can't pay or they can pay, we'll give them their services. That the eligibility is not like a requirement for them to get their services. It's just that will help them pay or that will pay for them. But even if they can't pay, we try to work something out. Sometimes they're in situations where they're not able to pay, and we understand.
Okay. And then do y'all ever, I guess, do y'all have a process of if a parent goes in or even like a child that goes in that doesn't maybe have any insurance at all, do y'all recommend, do y'all tell them like, hey, like, just want to let you know that you could qualify
Yeah.
for Medicaid, or you could qualify for Healthy Texas Women's insurance? Like, how does that, I guess, what is that process? Do you just let them know and refer them that they can apply, or?
No, we do the applications for them here. So we
Oh,
assist them with the
okay.
applications, yes. So when they first come in, they'll get screened for all the programs just to
Okay.
see what they what they are eligible for and what those programs can cover for them. So
Okay.
sometimes the program will be one of the programs will be able to cover like their pap smear. The other program is not going to cover the pap smear, but it's going to cover their mammogram. So we're able to use them all together so they can be covered and they don't have to pay.
Hmm.
And we'll help them with any applications they need, like you said, like the Healthy Texas Woman, or if
Mhm.
they need SNAP chips or anything like that, we'll help them through those, figure out those applications and help them apply as well. Even if they have to renew their application, we'll help them as well.
Oh, okay. See, I didn't know that. I knew that like y'all probably told them that they could, but I didn't know that you helped them
Yes.
like process, like if they're like, yeah, like I want to go ahead. And so you have to have permission from them to be like, yes, I do want to apply for Medicaid or Healthy Texas Women, correct?
Yes.
Okay.
It's really good to know that y'all do so much because, just the title, family planning, just
Yes.
makes you think of birth control and such as that. So I guess, do y'all have any numbers on, for example, how many college kids that you see that are just walking across to get, some type of health care?
Yes, we see a lot of the college students, mostly when it comes for their sports, to get their sports screenings. Sometimes, they need STD testing. We provide all that for them. And even if if something comes back abnormal, we provide the medication. And it's easier for them to follow up with them as well. Because sometimes when they tell you, okay, go get your screenings done here and go pick up your medication over here, sometimes it doesn't connect. And they get busy, they end up not going to what they needed to go do. So it's like a one-stop shop. You come here, you get your screenings, and if you need medications, you leave with the medications that same day.
And then you said, so like reading there, you're saying that you have like medicine on site. So if
Ye-
a parent went in, maybe they had a UTI, or maybe they even something came back, from their PAP or anything like that, they're able to get the medicine directly from y'all.
Yes, and even sometimes if they have the the symptoms, it doesn't hurt to give we also give them the medication presumptively, even if they have this, like, because they may have symptoms. The medication won't hurt them if they take it. So sometimes we give it to them even before we get the results, so the medication can already be working. We don't wait until the results get there, you know?
Yeah. And then you do, like, like Janelle said, I know you're not affiliated with Planned Parenthood, but do y'all, like, if somebody wants to go in, a parent or anything, wanting to get like contraceptive, I mean, do y'all offer that as well?
Yes.
Okay.
Yes, actually, this is not the correct flyer because it doesn't have it on there. But yes, we do offer many different types of contraceptives, long acting, short acting, pills, patches, rings, IUDs, the Nexplanon, the implant, the shot. We do offer a wide variety of different contraceptives.
And do y'all do ultrasounds? We have Image Clear Ultrasound, that's a nonprofit also, that does ultrasounds for women. Do y'all do that?
We're not able to do the ultrasounds. However, we refer them out. And we sometimes we can pay for them, so they'll be covered through us. We do pregnancy testing and confirmation, and we apply them for Medicaid once we do the confirmation of the pregnancy. We help them apply for Medicaid, so they're set up already.
And then y'all just strictly, it's not, I guess, it's not like, hey, if they were to go in there and they're like, I have a cough, right? I mean, y'all don't.
Yes, we can see coughs, yes, and
Okay.
anything like that. So it's like a kind of like a regular clinic. We'll help you with anything we can. Like if you have a
Okay.
cough, a sinus infection, or anything like that, you're more than welcome to come in and get tested or screened and get medication.
Oh, I see. I didn't know that. I thought it was just kind of, I mean, I kind of knew like a little bit, but I didn't know, what extent. And the reason why I ask is, most of the kids that we do serve, right, they have insurance, but I know parents don't, or they may not even know that that's an option, or, they're like, well, I can't go to the doctor because, I have a cold and it just doesn't want to go away, but they don't have the insurance, and you're still having, you go to like Stat Care and you're still having to pay $85 out of pocket. So that's good to know. I didn't know that y'all did. I guess just that, like if it's like you said, like if it's a cost or a sinus infection.
Yeah, they're more than welcome to come and visit the clinic and get screened, and they'll get their medication if needed. Even we see anybody, like when they first come in, they're not, if they have like an ID they can bring it, but it's not like a requirement. We don't require them to bring any paperwork in.
Okay.
Yes, we do see undocumented as well. They're able to get their services as well, and we have programs that they can be covered through as well.
Well, that's good to know. And then as far as the children, right? So you see nine and up, but I mean, do you, I guess, recommend that they still have obviously a primary pediatric doctor?
Yes, because there's a limit to what we can help them with. You know,
Okay.
we can like sore throat, cough, anything like that. But other things like if they have asthma and stuff like that, they would have to actually have a pediatrician so they can, have be checked, more
Right.
constantly.
Yeah. And then so you have the location here, which I guess just like kind of like within the area, because I don't think the only area I think that we cover, or that CASA covers, is Keensville, but obviously our kids can be placed anywhere. And so when you had mentioned the mobile unit, you said it's just, so y'all aren't something like, let's just say, right, like if we have kids that are placed like in Benavides or Fallon, they're just not able to get to y'all, you won't take the mobile unit over there, right? It's not like something
Yes, if
Oh,
if
you
it's
will.
yes, if it's
Okay.
requested, we can. Yeah, you just like what I said, you do the request online, or
Okay.
since you are gonna an organization, y'all can go ahead and call us, and then
Okay.
just ask for Sarah Villarreal. She's
Mhm.
a mobile health unit manager, so she will see when she has any availabilities in her schedule, and then
Okay.
kind of work with you to set it up.
Okay. So like let's just say like one of our volunteers um want, like they had a parent and they knew that the parent, couldn't get, to the clinic, maybe during your normal like business hours, then could one of our volunteers call her to say, hey, I work with Brush Country Casa. I have a parent that lives here. They don't have a way of transportation. They can't get there during your regular hours. Is there any way you could go out? I mean, are they able to do it, or would it have to come directly from us?
No, I believe they can do it there, but now if it's like for one person, they would request it through the website. Now, if it's
Okay.
like an event kind of sort of thing that they have multiple people,
Mhm.
you can call her and contact her
Okay.
and set it up with her.
Okay.
And we also provide like transportation vouchers. We help them with the transportations. If they have a car, we help them with gas. We also partner with Real. Sometimes they can take them and bring them back, and we'll pay for that.
And is that something like one of, let's just say one of our volunteers calls, or one of our parents were to call you and say, hey, like I don't have a way of getting there, or hey, I just don't have money to be able to put the gas. I mean, is that something that they would then call you and you would kind of,
Yes,
okay.
and we can help them out. We go drop off the gas card or anything like that, or we'll give them the information for Real, and we'll tell them, hey, we'll pay for it. Don't worry about it. Yeah.
It's just good to know. I like, the thing is that usually when we do some of these volunteer, meetings, I try to make it to where it's, more like the advocacy part, but I think that sometimes we do leave our parents out a little bit. And so I try to give our volunteers enough resources. That way, if parents do tell our volunteers, like, I can't do this, or our volunteers know, hey, I know this program, I know that you can do it. I know they'll go to, like, just to where they can't sit here and give us like, hey, I can't do that. There's a lot of, I know, organizations like y'all's organizations that is willing to help, and it's just maybe they just may not know about it. And so
Yes.
that's why, like, for all the organizations, that I see all the time, even if it's not directly just specifically for our kids, because I think it does help our volunteers to know. And then I feel like it even helps it outside of, CASA in general. Maybe
Of
our
course.
volunteers could use your service, things like that. So,
Yeah, any of
uh,
their volunteers or their family, anybody's welcome.
yeah. So that's the reason why, like, I specifically wanted, to get y'all to, I know I've used y'all specifically for my son, and the physical was like really a lifesaver because I needed a physical like that week, and I did not want to have to to drive to Corpus for that physical. And then
Okay, so it's a
we
good
let
little
all
drive.
yeah, and then we let like all the rest of our like football moms know, like, hey, you can come, like you can go there. And so we had sent a few y'all's way at
Thank
around the
you.
same time. I'm like, it
Thank
was
you.
really a lifesaver.
I've
Good. I'm
got a
glad.
question about your mobile unit.
Yes, ma'am.
Um, Say like it's getting close to football season and I'm in Fremont.
Okay.
And could we request the mobile unit to come for like sports physicals?
Yeah. If the mobile unit is
Okay.
not available, if the mobile unit is not available, we'll choose a clinic that is close by. And if you have a room, we'll do them in that room. We can do all the sport physicals there.
Oh, okay.
Yeah.
That's good to know.
Yeah, so it doesn't, if
Thank you.
sometimes the clinics might be booked. I mean, the mobile unit might be booked for that date. Doesn't mean that we can't ask one of the clinics if they're available, and we'll just shut down the clinic for that day and then go into whatever area. We do like pop-up clinics as well.
Okay. Sounds good. Thank you.
You
Of
only
course.
see 9 and up, correct?
9 and up, yes, ma'am.
Okay, because I know that when we told our freshman parents, which is like, I think 5 and up or 6 and up, they were like, oh, we can't go there because they only see. And I was like, yeah, that was the only thing that like, I think I remember. I was like, if you're a sophomore and up, you can, but if you're a freshman, you're going to have to try somewhere else.
Yes.
Does anybody else have any other questions that they are maybe curious about? I'm like, I try to ask as many questions just so that way I kind of had everything that I wanted to ask. All right. Well, if nobody has any other questions, Fatima, unless you have other information to share, but if you can, I know that y'all have given me this flyer in the past.
Yeah.
I usually put it up for our volunteers and where our brochures go. But if you have any updated information that you want to send over, and then usually after this call, anything you want to send me, I usually send out to the volunteers in like an email just for them to have if they need to refer it back to it.
Yeah, of course. I can send you the updated flyer.
Okay.
I'll go ahead and send you that so you can share with anybody you like.
And then if you can just, I guess also, if you could provide that link, that request link that you said, like if
yes.
one of our volunteers wanted to specifically just for one person, and that way they also have that on hand that they could also give anybody that they're working with within their case.
Yes, ma'am. I will do that.
Awesome. All right. Well, thank you so much for taking the time out of your day to educate us a little bit about South Texas Family Planning Clinic. And I do look forward to seeing you soon. And any events that you may know of, you can send them to me. And any events I know of or that we have, I'll definitely make sure I send them to you.
Thank you. Yes, of course. It was my pleasure.
Thank you guys. You'll have a good rest of your day.